afternoon, everyone, and welcome back to another session of the medical debate. Today, we're going to be talking a little bit about medical negligence. So first of all, what is medical negligence? If you have any ideas already, please put them into the chat or the comments below, and we'll be able to respond to them. The definition of medical negligence is referred to as clinical negligence, since it covers not only core medical professionals, but also dentists, physiotherapists, and psychologists. So medical negligence, or clinical negligence as it's also known, can cover a wide range of medical professionals. And negligence in general is used to refer to when the treating clinician provides treatment which falls below a standard considered as reasonable for the clinician's experience and specialism. And this may be by doing something which they should not have done, or failing to do something which they should have done. And we're going to look at a few examples of this later on in the session. So where a patient suffers an injury as a result of this failure, they have a right to claim compensation for their injury from the clinician. And in the UK, the NHS itself would be sued for medical negligence if a patient so chose. So where could, which areas could give rise to claims of medical negligence? Well, basically all aspects of medicine, all specialties have the potential to give rise to these claims. And we're just going to go through a few of them now. So first of all, obstetric or midwifery care during pregnancy or childbirth. And we're going to talk a bit more about this a bit later in the session as well. But this is to do with whether a baby does not receive the correct treatment when they're born, if they have an infection, for example, or if a baby dies during their birth, or if a mother dies during childbirth or during labor. These can cause people to sue the NHS because they think that damage has been done when it could have been prevented. And this can be contested in many cases. Another large area which often gives rise to medical negligence claims is plastic and cosmetic surgery. And this includes breast augmentation, rhinoplasties, and facelifts. And often when people aren't content with the outcome of these surgeries, then they will provide a claim for medical negligence because they think that the outcome wasn't good enough, it's not what they expected, and they will try to sue in those cases. And with plastic and cosmetic surgery, there is a risk of complications, and also there isn't an exact result. So the patient can never really know what it will look like or what it will feel like, which is why these are particularly controversial. Orthopedic surgery is often a large area which could give rise to these claims, and this is because of failures to properly treat fractures, for example, A&E and emergency care, including failure to diagnose strokes, heart attacks, fractures, and brain hemorrhage. Failure to diagnose any of these things can lead to potentially devastating consequences, and therefore, if not diagnosed, a patient may feel that they've been improperly treated and therefore entitled to compensation. GP care, this again can include misdiagnosis or failure to refer, such as cancers, cardiac diseases, strokes, and heart attacks. And if a patient isn't referred to a hospital by a GP, then when they should have been, then they can choose to sue or claim medical negligence compensation. Furthermore, urology, general surgery, gynecology, keyhole, or laparoscopy, these types of surgeries can lead to complications, and when patients are left damaged after these surgeries, despite knowing the risks of the surgeries, they may choose to sue. Anesthetic errors as well, including anesthetic awareness, and this is where a patient may, despite being given anesthesia, they may not be given the correct dosage, or they may be given the incorrect type of anesthesia or be allergic to the anesthesia that's given. And in these cases, this can cause discomfort, pain, or awareness during surgery, which is obviously not pleasant for a patient and can be painful at times. And this is a major cause for medical negligence claims as well. Dental negligence during dental treatments, such as implants, and nursing negligence as well. So as we can see, there are a huge range of areas in which negligence claims can be given. I'm going to now look at a few facts about medical negligence. So first of all, there were 10,678 claims made last year, which is quite a significant amount. And as we can see, full-time GPs are now twice as likely to receive a claim for negligence as they were a decade ago. So at this point, you might be thinking of some of the issues that this could cause, especially since GPs are under a lot of stress, and we know that GPs, especially in this country, there are many complaints about doctors working too hard, being underpaid for the work they do, and on top of that, being sued for medical negligence can be quite a burden. And even if the claim turns out to be overturned, then it can be quite a lot of hassle and paperwork and visiting court in some cases for GP, which is obviously not good. And of course, there is the cost as well. So the NHS paid out £2.4 billion on medical negligence claims, and we'll discuss the impact of that later. 4 out of 10 people with cancer are reportedly misdiagnosed at least once. And of course, with improving cancer care and diagnosis technology, this is decreasing. But still, a misdiagnosis for cancer can be potentially disastrous for people. Firstly, if people are told that they don't have cancer when they in fact do, then that can lead to treatment being delivered late or even not at all, and that can really damage a patient's well-being. However, the reverse is also true and equally disastrous in many cases. There have been several cases of breast cancer patients, for example, having their breasts removed surgically, or testicular cancer patients having their testicles removed, despite them not actually having cancer or being misdiagnosed with cancer. And this can, of course, have many mental health effects and social effects, for example, infertility and aesthetic appearances, which can be really damaging to patients if they're carried out without an actual reason as such. The NHS received 2,924 written complaints, and the General Medical Council received a further 8,197 complaints, only 6% of which were sent for further examination. Research suggests that nearly a third of heart attack cases are misdiagnosed, and again, this can have devastating impacts, like with cancer patients. And in March 2010, a review found gynecological, skin, urological, and breast cancers were most vulnerable to delayed diagnoses. And as I mentioned before, delaying a diagnosis or receiving treatment or care late can be devastating as well, because cancers may grow, they may move, they may metastasize, and obviously that can be particularly damaging for patients. We've got an example here. We're going to talk a little bit about home births, which we've obviously covered in some of our previous sessions. A recent study suggested that home births could be as dangerous as driving without putting your child's seatbelt on. And this is due to households not being equipped with specialist staff and equipment in case of an emergency. So I'm now going to read out the little case study we've got here, and then we're going to talk about home births and their link to medical negligence. Dom and Flo are a couple who visit your clinic. They are expecting a baby and ask you if it is safe for them to have a home birth. You explain the risks of having a home birth, and they tell you that they would like to go through with it. A week later, they come back with their baby daughter. They tell you that she has developed a fever after she was born and was refusing to feed. You realize that she has an infection and immediately start to treat her, knowing that the damage could be severe. Although you manage to keep her alive, you realize that she may experience lung issues while growing up. You believe that this could have been prevented if the baby had been born in a hospital and given treatment immediately after birth. So this case study shows the link or the conflict between autonomy and beneficence or non-maleficence, the idea that patients are entitled to their own opinions and own views and own judgments regarding what treatment they receive, but at the same time, it is a doctor's duty to try and provide the best care for a patient. So in this case, would it count as medical negligence? No, it wouldn't, because the patients have made, rather the mother and the father have made an informed decision. They are fully aware of the risks, and it is perfectly legal to have a home birth. So no, they couldn't claim medical negligence here. However, some argue that it should count as medical negligence if a doctor is aware of the risks of a treatment and allows a patient to undergo a more riskier course of treatment. In this case, it wouldn't, but many people believe that this is where an argument comes into play between whether doctors should give their patients autonomy to choose, or whether or to what extent they should control the treatments that their patients are receiving. And this isn't just the case with home births, this is the case with many different other treatments, most notably, in recent times, vaccines, whether doctors should allow patients to not be vaccinated despite the many risks that can carry. Does it count as medical negligence? No, it doesn't, because the patient is making an informed decision. And that's why many people do claim negligence, especially in cases like these, which turn out to not be successful. And as we mentioned on the previous slide, out of the complaints that were given, only 6% were sent for further investigation, and only 18% were investigated. And there is a very low amount of cases that actually go to court and actually are overturned, because in most cases, a doctor is fully equipped and they have made the patient aware of the risks. Medicine does inevitably fail, and there are always risks and always things that could go wrong. But as long as the patient has made an informed decision and nothing was, they weren't misled in any way, and they weren't given a course of treatment inappropriately or an ineffective course of treatment, then they are not entitled to a claim for negligence. We're now going to look at a case of medical negligence in the news from last year. And this is to do with the huge fee that the NHS faces, the huge bill that they face due to negligence fees. And as we mentioned a few slides ago, here we can see the NHS paid out £2.4 billion on negligence claims. And we know, and in fact, in 2020, this figure seems to have been updated to £4.3 billion. So this is obviously a huge amount of money, and obviously, since the NHS is largely funded through the taxpayer, many would argue why their money is going towards settling these claims. Instead, should it perhaps be going towards improving innovation, improving facilities within the NHS? Should people be entitled to compensation for negligence, especially in small cases? Or would it be more moral in terms of providing better treatment, to not have this option available? So each year the NHS receives more than 10,000 new claims for compensation. This figure includes all current unsettled claims and the projected estimates of ones in the future. And the Department of Health has pledged to tackle the unsustainable rise in the cost of clinical negligence. Estimates published last year put the total cost of outstanding compensation claims at £83 billion. And the NHS England's total budget was 129 billion. So as we can see, compensation does have a huge bearing on the NHS's budget, how much healthcare ultimately they're able to provide. And this notable case was to do with Hayden Nguyen, who was born in August 2016. And 6 days later, he died at the Chelsea and Westminster Hospital in London. His heart failed after it was attacked by a virus. And initially, Hayden's parents did not know what had happened to him. In the face of official silence and in a bid to get answers, they took legal action against the hospital. After 3 years, the trust admitted liability for a failure to adequately treat his condition. The Nguyens received a small amount of compensation and their legal fees were met by the trust. His father, Dong, said, "It was every patient's worst nightmare. We had to sit there and watch our son slowly die in front of our eyes." So obviously, in cases like these, it's very important for some parents to get the compensation, to be compensated for this huge amount of damage that's met. But at the same time, does that really balance the immense cost of these bills for the NHS, especially considering this money is coming from the taxpayer? So what do you think? Put your thoughts down in the comments. Do you think that patients should get a reduced amount of compensation for negligence claims, considering the immense stress the NHS is under financially? Or do you think patients should always be entitled to full compensation when things go wrong? So, other breaches of patient rights. Where might a medical intervention go against patient rights? So we've got a few other examples here, which people would, which can be linked to medical negligence. Euthanasia, for example. It goes against good quality care, but respects a patient's choice. And this is something similar to the home birth scenario that we looked at earlier. So some might argue that it's negligent for a doctor to allow a patient to die, to tell them and permit them and aid them in killing themselves ultimately. But others might say the opposite. They might say that it is a doctor's duty to respect a patient's wishes, to respect their autonomy. And so with euthanasia, it really is the age-old debate between autonomy and non-maleficence and beneficence. Secondly, NHS resources. Should a patient be treated by a less experienced junior doctor or by a consultant? If a junior doctor makes a mistake, and many would expect a junior doctor to be more likely to make mistakes considering the lack of experience they have when compared to a consultant, should a patient be entitled to complain and say, I should have been treated by a better doctor? Should that be allowed? Or, in order to avoid this issue, should we limit the amount of treatment that junior doctors can provide? What impact would that have on the medical profession and on NHS resources in general? Futility, thirdly. Should a doctor refuse treatment, even if the patient wants it, due to it being futile? Some might argue that it's negligent for a doctor to not provide treatment, although some might say that it's responsible for them to not provide treatment if this treatment is futile. And fourthly, doctor strikes. If doctors are striking, then should that count as negligence? Is it ethical for doctors to go on strike and not be treating patients when patients need to be treated? But ultimately, in the long run, could they improve patient care? And therefore, it would be there wouldn't be a case for negligence in that case. So put your thoughts in the comments below. Do you think these count as negligence cases? Do you think of any other similar cases in which some might claim medical negligence? So we're going to move on now and finally talk a bit about AI and medical negligence. We've got a little example here, and this is probably set in the far future, where we're assuming that AI has become integrated into conventional modern day medical care. Let's say an invasive surgery was being carried out by a robot, but the robot has malfunctioned and created a deep cut in the stomach. Who is responsible for this? So in these cases, and more and more, many cases, many treatments are being provided by robots, by artificial intelligence. A lot of medical care, even today, is undertaken by computers or guided by computers. Even X-ray, CT scans, if these malfunction, if there are errors with technology rather than people, who is responsible? Is it the doctor themselves, the consultant who is in charge, or the manufacturers of these machines? So yes, please put your ideas in the chat below, in the comments below, and we'll be happy to respond to you regarding this. But today this isn't so much of an issue, but in the future, could it be an issue? Since there is no real outline for whether a patient can sue a robot, whether they should be allowed to sue a robot. Robots can make mistakes just like people can, but is that really anyone's fault as such? So yeah, that brings us to the end of the session today. Thank you very much for attending. If you have any questions, please do email us on themedicaldebate@gmail.com, and please do email us here if you'd like to be added to our mailing list in order to receive the link for future sessions. Alternatively, please DM us on our Instagram at The Medical Debate, or leave a comment down below. Please also do subscribe to our YouTube channel, The Medical Debate, and you'll be able to see all our future videos and guest speakers and talks that we upload. And do also follow us on Instagram to stay up to date with our future sessions and guest speakers. Thank you very much, and see you next week.